Intracept is a really new technology in the spine space, and what it is a very minimally invasive procedure where a radio frequency probe can be introduced into the body, and it addresses basically the sensory nerve that tells the body that there's pain coming from some problem in the lumbar region. It's only approved right now for lumbar, and for people who have chronic lower back pain and they don't have nerve problems, this could be a really effective, minimally invasive technique to address that pain.
One of the biggest things that every spine practice sees is patients who have back pain, degenerative disc disease. The vast majority of those patients don't require a fusion and they don't have nerve impingement necessarily, but they have back pain. So about 80% of back pain is related to degeneration of the disc, and about 20% is related to degeneration of the facets alone. And then there's some overlap in that. Well, when people have facet degeneration, we actually always had procedures, injections and rhizotomies, ablations that we could do for those. We never had anything we could do that could address the discogenic pain. So the thing about the relevant procedure is it allows us to do the same thing with the disc that we do with the facet joint. So you can do a facet nerve radiofrequency ablation, make that joint numb for an extended period of time. Now we actually have the ability to get to the central nerve in the vertebral body that supplies the disc to do the same thing for the disc, for people who have just discogenic pain and disc degeneration.
It's an effective way of treating back pain without fusion. So it's a very minimally invasive technique that's outpatient, and yet it's been shown in its trials and in its studies to dramatically reduce the amount of back pain that patients are having. And again, it's not a fusion. There's really very little downtime, so to speak, post-operatively. It's still a procedure, so it's still considered surgery, but it's an outpatient. You're not spending days in the hospital, and again, it's not having to fuse two of the backbones together, so there's none of the other potential risks involved with that.
When it comes to treating chronic back pain, if you can do the least amount to get the most pain relief without any addiction and with minimal risk of complications, then that would seem to be the best way to go. And Intracept offers the possibility of that happening.